Yeah, my name is Gary Chirenga. I'm the CEO of Kigali Trust Clinic. It's a clinic in Kigali that is specialized in neurology, dental, and pediatrics. We also have physiotherapy and general medicine. But I'm also Kunga Therapy expert. Was one of the people who wrote the Kunga Therapy book. We wrote Kunga Therapy book, one of the team that actually made this therapy possible. We've worked on this more than 8 years. It started being used in Zimbabwe, Uganda, of course even here in Uganda for some time, and Tanzania and Rwanda 8 years ago. In Kunga, of course, it's a company that does massage therapy. It's an medicinal therapy. There is no any use of medicine, either modern medicines or traditional medicines. It's a therapy that mainly focuses on the back, working with some points in the back in the repair of sympathetic neurons, because it's a therapy that mainly look for repairing sympathetic neurons damaged, because those neurons damaged are the one that causes most of the issues that genuine Kunga therapy works on. So it's a company that is based in Rwanda, Rwanda, Tanzania, Zimbabwe, Benin, West Africa, also in Central African Republic, and here in Uganda we also have a very big center, as you can see. It's a very big one here in Munyonyo, next to Uganda Matters. When you arrive at Impala Hotel and Uganda Matters, you just 15 meters. It's next to Uganda Matters Shrine. Yeah, about back issues, I would say, for me, I've been in the field of medical field for a very long time, and from what I've seen, from what I've realized, either through testimonials, either through what I've seen myself, I name Kunga therapy as the best treatment someone can ever have for the back issues. Why? Many people that I've seen that got help with Kunga therapy who had the back issues, either disc protrusion, either degenerated disc, either herniated disc. I would say normally it's very hard to say that you can help someone 100%, but I can say 9 out of people that get that treatment, Kunga therapy treatment, who have back issues, either in lumbar spine or thoracic spine or cervical spine, I can say 9 out of 10 people, they get help. And not only those people who haven't yet gone under surgery, even for those people who went for surgery in Europe, elsewhere, but when they have that therapy, and it doesn't take long actually for those people, unlike autism and cerebral palsy children and paralyzed people and Down syndrome children, for people with back issues, the same with people with arthritis, people with rheumatism, people with osteoarthritis. It doesn't go beyond 20 sessions. 20 session is mainly like 1 month and a half. So in 1 month and a half, someone who was not able to sit at all, they sit. Yeah, that's what I can say. Autism, it depends. It depends. There are children of 3 and 4 years old. Of course, it takes little time compared to their older ones who have between 5 to 10, 10 to 20. Because there's even that child that we received. His mother was, they came from Canada. Actually, people come from Canada here to come here in Africa for autism treatment. People come from America. People come from, I think even you might have seen some people around here. Some of them are Canadian, others are American. So we've seen, since we started, we've seen actually many people coming from abroad to Africa, to Tanzania, to Rwanda, to Uganda. more than people in the area. So because someone who is in Uganda, when you talk about autism, when you talk about his child not being able to sleep, people also need to know some signs of autism. When you have an autistic child, he or she is not able to, they don't sleep, they don't eat what we eat, they are picky eaters, they have fecal incontinence. It means like they can't live without, they always have to live on diapers. And another thing, all of them mostly, they don't speak. There is no also eye contact, they are hyperactive going there and everything. So for someone in Africa, we've seen that in many African countries where I work from, when he has that child be in America, if I can be in Europe, if I can be in Canada, maybe my child can get help. But it's different. It's actually contrary. Because wherever we work with autism centers. I can very well tell you that for me, if I had my child and is autistic, I would prefer to take him in a Ugandan autism center more than taking him to Europe and Canada. Because for us, we talk with those parents, there is what they tell us of the situations there. So I would say there's still that problem of awareness. We still need to teach people what is autism, how an autistic child can get help, and good enough here in genuine Kunga, we are helping those children. We don't say we are healing them. We don't say we are healing them. We say we are helping. And we even go beyond to say we are helping your child with this. We are helping your child to sleep. We are helping your child to eat. We are helping your child to regain concentration. We are helping your child to be able to go to toilet. We are helping your child to be able to sit in a church with you for 4-5 hours. Because normally an autistic child, they can't sit even 5 minutes. Even 2 minutes, they can't sit. So that's why it becomes very hard to take them to normal schools, to take them to churches. So we've developed this 4 months treatment program. It's whereby they have to have like 4 sessions or 3 sessions a week for 3 to 4 months. And good enough, I can say 100% of them, they sleep. Fecal incontinence stop, they start going to toilet, they eat everything, they allow someone to brush them. So that problem with sensory issues, they stop, and they even gain that concentration. And we've had many of them even being able to be calm and attend the normal schools. So what we don't give 100% assurance is about speaking. We say 50% speak while they are here. 50% speaks like some few months after they had finalized their treatment. But remember, even if those 50% they are not able to speak while they are still here, at least they can be able to sleep, they can be able to be calm, the fecal incontinence has stopped, and the children are able to eat everything. Yeah, it's very hard to tell someone, if you are in medical field, it's very hard for someone who is in medical field to tell someone, stop your appointment. Because it's very hard even to get that appointment. But if someone has an appointment in the next 2 months, for me, I will tell him, come and see someone who got the same help you want. If you get, because for someone with back issues, the problem gets solved actually in 1.5 months. And it's even when you compare the cost to go to Europe, it involves having to board airplane, the apartments you pay there or hotel, and even that surgery. So when you compare the cost and the cost here in Uganda, of course it's different. And I wouldn't even name it as a cost compared to someone who would have to spend. So I think as Ugandans, as Africans, we've got some time to try our own things. If someone is telling you, come and test us for 1.5 months, why can't you? After all, you are going to spend more than 7,000 or 10,000 US dollar in those Western hospitals or elsewhere. So I would tell someone, come for 1 month and a half. You have back issues, you have arthritis, you have osteoarthritis, you have rheumatism. Come and try 1 month and a half and see. Help them, but like I told you, we are very, very well genuine with what we do. We don't tell people that, for example, for a child with Down syndrome, many people, for someone who doesn't know, it's a problem that happens with one of the chromosomes when the child, the egg is getting formed in the uterus. So that problem, I can say that problem is that chromosome that happens end up causing those children to have their eyes, like their eyes become small, their ears becomes small. So we don't tell, and most of the time actually even their height does not become like the people who are normal. So you find the child his height has been shortened, his eyes, his ears, you see something has been tempered with, and it also affects their brain, because most Down syndrome children, you can't expect them to go and study primary, secondary school, university, and finish and be maybe a doctor or a scientist somewhere. So it will be like a miracle. So what we tell some people, for a child who is not beyond 10 years old, we can help them to recover their brain. Like when you know my child now can be able to learn, can be able to write his name, can be able to calculate certain stuffs, my adding, subtraction, so that you can see my child that is, even if he doesn't go to university, he can go to vocational trainings and he make a life of his own. So for those children, you help them to recover their brain and also to recover their speech. That one I can assure someone 80%, that's what I can say. But regarding his eyes and the ears, we don't promise someone that we can help with that unless the child is below 6 months, because there are those children whom we have received in the past who are 3 to 4 months, 3 to 5 months. There's even the one that we treated, she was 1 month. So we don't tell people that we can help change even the eyes and the ears for a child who is above 1 year old. That's what I can say about Down syndrome. It takes the same as for those children who are below 15 years old, and what we normally look at for someone to say that my child doesn't really perform well in class. If your child has been in P2, let's say P2, someone is in primary 2, and he's been there for 5 times or even 3 times, you find that something is really not working. So what we do, even people ask us, okay, how can you actually help someone who doesn't perform? The answer is simple. There's some part of the brain that your child does not use. The same way, ask yourself, if you have a phone that has 20 GB, someone else has a phone that has 500 GB. So your storage is not the same. And then for those children who fail in class, it's not because they don't have the same brain volume with ours. That's not the problem. The problem is there's some parts of the brain that are actually not active, and mostly the storage part. So what for us we do, there are, maybe he will show the people, those sympathetic neurons connecting to the heart. Mostly we came to find most of the children who fail in class, and if you are watching us and you have that child, there are 3 things I'm going to ask you to look at as observation. Your child mostly will have headache. Your child will have headache. Most of the children who fail in class, People don't get to notice those things, but most of them, they have that problem of headache, they have that problem of upper back issues. Most of them, they also have that problem of poor breathing. So if you are a scientist or a doctor, you can even look at sympathetic neurons that connect to the heart. They pass through thoracic region. And if you very well have the capacity to take your child through scanning, go and see. You will find that your child has actually a problem in the thoracic spine. So he had the same things that I told you. So we had to work on his upper back, and he got relief from headache, migraine. He got relief from that poor breathing. And in that year, he was among the best success in his school when he was finalizing senior 6. So what I can tell, it doesn't go normally beyond 26 sessions. That's almost 2 months. That child was the most older child the older child we've ever received. He was 20 years. Mostly many of them, they're 18, 16, 14, 12. So, and we've found good results. And actually you start seeing results in 3 weeks. And the teachers actually are the one that tell you, wow, today he got 7 out of 10. And you know your child has not been able even to secure 2 out of 10. And all of a sudden he gets 7. So the teachers are the ones that actually start telling parents, we are seeing some changes with your child. It's another thing that I had forgotten. Most children who don't perform well in class, it's also something that someone has to notice. Maybe someone will say, but that's not possible. How can you do it using just hand? It's very hard to believe. I'm going to say another thing that you can realize with your child if he doesn't perform well in class. Most of them, they are bedwetting. They are bedwetting children. So most of them, I can say 80% of them, they have that problem with bedwetting. So it's also another thing that you have to see. And by the time you look at the other chart, Kunga Therapy chart, which shows sympathetic neurons, you found that around L1 to L4 in the lumbar spine, that's where are neurons that are connecting actually to the kidney and rectum and all that. So you find the reason why even some autistic children have the problem of fecal incontinence, because there are those damaged sympathetic neurons in the lumbar spine and those damaged sympathetic neurons in the thoracic spine. But in this case of children who face in the class, the disc which has problem and from lumbar 1 to lumbar 5. So when those sympathetic neurons connecting to the kidneys and these genital organs are not, when those sympathetic neurons get damaged, they lose control, because sympathetic neurons constitute the peripheral nervous system of the brain. So it's the communication between the brain and our internal organs. So if that part of the brain that actually helps the brain to command how you urinate, even the impulses that it goes to the brain to show, you need to go to toilet, because we found that there is a signal that is coming down there that wants you to go to toilet. So that's why most of children get that problem, because those impulses do not reach the brain. So when you work on those, they start going to toilet even in the night. So most of those children who face in the class, you find that they also have that problem in the lumbar spine, which causes them to have bedwetting issues. Someone who is not convinced, for me, I always tell people, if let's say there's a time we had an interview, I remember we hadn't opened our center in Uganda, but now we are in Uganda. That time there are people who came and we helped them, but now the center is in Uganda. Before you could say there's a problem of like that capacity, financial capacity for me to board an airplane with my son or me myself to to go in a certain country, why can't you open Uganda? So if that thing is in Uganda, why can't you just go there and give it a try? And the best thing with our treatment, someone starts seeing changes in the first 2 weeks. So for someone, and let's not say even trying, when you go to any center where people are doing what they say they are doing, you find people who have gone for those services and you consult them. So no one can come to the center just to lie to you. So I will tell people to come and visit the center here in Munyonyo, next to Uganda Matters. They will find a very big center with the signpost genuine Kunga, and they will get it. And also it depends on which issue you have, because people will not have someone have 20 sessions, especially for those people with back issues. But for autism, it does it normally in 40 to 50 sessions. Children are able to sleep, to eat, and even fecal incontinence stops, and even they gain that concentration. So they start speaking between 50 to 70 sessions. But for someone with the back, they start feeling changes even in 7 session, 9 session. So it doesn't go beyond 20 sessions. So prices are different, and what I can do, maybe let me say the number is 077 64 36 554. Yeah, let me, and another number for people I think with Airtel, 0702 345 510. So those are the numbers that someone may call. Maybe I can also give my own number for someone who wants other explanation. Is +250 788 31 0465. So we are here in Munyonyo. It's next to Uganda Matters and Uganda Matters Shrine and Impala Hotel. So it's a house next to Impala Hotel. Yeah, thank you so much.